So firstly we have Sally Mcmanus, a tireless activist, Secretary of the Australian Services Union of New South Wales and ACT.
Thank you. Medicare is the principle and the promise of universal health care for all. It's something that was fought for and won by the union movement, by working people, the labour movement of Australia. It's uniquely Australian. It's the most effective universal healthcare system in the world. Ever since the labour movement started to try and achieve universal healthcare, the Conservatives and the rich and powerful in Australia have fought to wind back or to stop its introduction. This started in 1949 when Chifley first tried to nationalise healthcare services. It was fought for viciously at the time by the rich, and that was doctors. They did not want that service. They took a high court challenge and they won. But ever since then, the union movement, workers have continued to fight to win this for all Australians. And it was when Whitlam got elected in the early 70s when Medicare private was first introduced and we first had the major breakthrough. This was opposed tooth and nail by the Liberal Party at the time. And then when Fraser came into government, what did they do? Well, first of all, they tried to get rid of Medibank Private. That was one of the first things. And this led to one of the only national strikes, general strikes in this country in 1976 to defend Medibank Private, to defend these gains that we've made. And eventually, in 1984, we won what we've been fighting for, and that's the Medicare that we have today, introduced by Bob Paul. And this was a demand. This is a demand of the trade union movement. The trade union movement gave up, all workers gave up pay increases in order to win Medicare. We did that and we fought for it for everyone, whether you work or whether you don't work. And what is Abbott doing? Are we that surprised that one of the first things he tries to do is flies a kite about undermining Medicare? Now the co-payment, let's be clear about this. It is breaking that principle of universal free health care. That is what he's trying to do because he knows it's very popular. It's popular whether you're working class, whether you're middle class, or whether you're ruling class, it's quite popular. And so he wants to break that nexus, break that principle, and it's a wedge to try and move towards eventually what the private health funds are demanding, which is an American-style, privatised, free market health care system because there's a ton of money to be made out of it. This is what they've always believed, and this is what they're continuing to fight for. Well, let's just look at what he did. What did he do? The day before Christmas, when all bad decisions get made, he introduced a 6.2% increase to private health funds. 6.2%. And you think about how much the private health industry is subsidised by the taxpayer in this country. Holder would not dare ask for the amount of money that they receive for their profits. And so it is those same people that are now demanding these changes as they see this is a way towards achieving, making massive profits out of our health care. We cannot let this happen. This generation cannot let this happen. This system was built by our grandparents and our parents. And it must be us that stands and fights, just as everyone has done before, to defend Medicare, defend the principle and the promise of universal health care for all.